Welcome to the deep dive. Today we're exploring a concept that you hear about a lot, but it can be a bit fuzzy. Social capital.
Hmm.
We're going to dig into a really interesting 2007 article by Sara Ferlander that looks at its connections to your health. And some of those connections are, well, surprising.
They really are. And while we often think of social capital as just, a good thing, this analysis really drives home why it's crucial to see the differences between its forms.
Differences, how so?
Because they mean very different kinds of resources, different support, and sometimes different demands or obligations that definitely impact your well-being.
Okay, so let's unpack that.
Yeah.
Social capital, what are we actually getting at here? The basic idea, Ferlander points out, is that our social networks or connections, they have real value.
Exactly. It's a resource you tap into through those connections. It involves things like networks, obviously, but also trust, norms of reciprocity.
Like expecting people will help you out if you've helped them.
Precisely. The article frames it almost like an investment in social relations with expected returns. You put time and energy in, hoping for a payoff later.
Right. It makes it sound less like just, friends and more like an actual asset.
It is. And that's what's fascinating. Thinking of it like financial capital, something tangible that benefits individuals, communities. But like any investment, it's not without its complexities, its demands.
And that's where the health connection gets really interesting, isn't it? The article stresses that not all social connections are, well, equal when it comes to health impacts.
Not at all.
It talks about several forms, but maybe we can focus on three key ones: bonding, bridging, and linking social capital.
Sounds good. And really, connecting this to the bigger picture, it boils down to the diversity of your connections and, crucially, who you're connected with.
Okay, so let's start with the first one, bonding.
Right? Bonding social capital. This is about your connections within groups that are pretty similar homogeneous groups. Think immediate family, your closest friends, maybe people in a very tight-knit neighborhood group, very inward-looking usually.
And these provide that core support, right? Emotional support, maybe practical help like a ride or borrowing something, the stuff for getting by.
Exactly that. Vital stuff. Relying on family in a tough time, friends listening. That's bonding capital at work.
Okay, seems straightforwardly good. But here's where Furlander's analysis gets really interesting. There's a downside to those close ties.
Yeah, it's kind of counterintuitive, but absolutely. That same closeness can be a source of major strain or conflict.
How so?
Well, think about group norms. If your closest circle has norms that aren't exactly healthy, maybe heavy drinking is normal or smoking or certain attitudes towards health,
Yeah.
that puts pressure on you.
Ah, right. Subtle pressure to conform.
Or not so subtle sometimes. And beyond behavior, think about the emotional load. If you're the one constantly providing support in those strong bonding ties, that can be draining, a real burden.
So the very thing that helps you get by can also wear you down or lead you down less healthy paths.
Precisely. It raises that question, doesn't it? How were the specific dynamics within your closest groups actually affecting your choices, your stress levels? It's a balancing act.
Okay, so that's bonding, crucial but complicated. What about getting ahead, not just getting by?
That brings us to bridging social capital. This is different. It's about connections across different social groups, more outward-looking. Think acquaintances, colleagues in other fields, people from different backgrounds or neighborhoods, heterogeneous ties.
So less intense maybe, but broader.
Generally, yes. And this is key for accessing new information, different perspectives, resources, maybe job opportunities you wouldn't hear about in your immediate circle. It opens doors.
And then there's the third type, linking.
Linking social capital. Yeah, this goes a step further. It connects people across different levels of power or social strata. So ties between, say, community members and local officials, or accessing people in institutions.
Ah, so it's about connecting upwards or downwards in the social structure?
Kind of, yeah. It enables access to resources, information, even influence that are outside your usual social sphere entirely. It can connect you to decision-making processes.
Okay, so we have bonding, close ties, bridging wider ties, and linking vertical ties. What do these wider bridging and linking connections do for health?
Well, both bridging and linking, sometimes grouped together as cross-cutting social capital, they tend to show real benefits for mental health. They can also help spread healthier norms across society, not just within one small group.
Makes sense. More diverse information, maybe lake pressure from one single group.
Exactly. And they empower communities by providing access to different kinds of opportunities and information. They broaden your horizons.
So, thinking about all this, what does it mean for people, for communities? The article points out something pretty crucial about distribution, right?
Yes, absolutely critical. These
Yeah.
different forms of social capital. They are not evenly spread throughout society.
For example.
Well, you often find that people in, say, poorer or more marginalized communities might have really strong, essential bonding ties to
Yeah.
survive, practically.
That makes sense.
But they might have far fewer bridging or linking connections, less access to those wider networks, the different resources, the institutional links.
And that lack of balance, that's a problem.
It can be a huge problem because it can reinforce existing health inequalities. If you don't have those bridging or linking ties, you might miss out on health information, job opportunities that could improve your situation, or ways to advocate for better community resources.
So relying only on bonding, while vital, might not be enough for overall well-being or community health. Exactly. The ideal scenario for both individuals and public health seems to be a healthy mix, a balanced distribution of all three types: bonding, bridging, and linking capital.
Wow. It really shows how complex our social worlds are, doesn't it?
Yeah.
And how these connections, in subtle ways, are deeply tied to our health.
It really does. It makes you think, doesn't it? Maybe take a moment to consider your own life.
Yeah.
How might that specific mix, the balance of bonding, bridging, and linking connections you have, how might that be shaping your own health, maybe in ways you haven't really thought about before?
Definitely something to chew on. Thanks for joining us on the Deep Dive.